So I'm discussing ProResolve, which is a natural compound that helps with recovery and helps with the healing process for athletes. And I've been using this for years. Really, really good feedback with this product. And so I'm happy to discuss it and kind of share my knowledge with it, and also a little bit of my experience with it. I'm board certified in both physical medicine rehabilitation, and I also did a fellowship in metabolic and nutrition medicine. Did a board certification in anti-aging regenerative medicine. Basically, I did this because my focus is in the performance realm. So I work in professional sports. I work in the NBA, NFL, Major League Baseball, and in the NHL. I see pro athletes from all of these major organizations, and I work with teams within all of these organizations. I'm also on the Tignum Performance Science Innovation Board and medical director for a club for the Breakfast Club, which is a program through the NFL Players Association, Trust, and Exos. I'm associate faculty at the Institute of Human and Machine Cognition. In fact, I've given a talk or a podcast on where I discuss SPMs. So this is not the first time that I've had some discussions on these things. And I work with a lot of veteran organizations, and obviously in these communities where you're dealing with retired professional athletes, active professional athletes, and with veterans, there's a lot of injuries, and these guys sometimes struggle with musculoskeletal issues. And so I've found that ProResolve has been a great way to help with these issues. This is a very unique supplement, and the goal of SPMs are to resolve inflammation. It helps with supporting natural recovery from injuries and inflammation. It promotes resolution of inflammation, reduction of pain, and tissue regeneration. And the nice thing is that these things are not immunosuppressive. It doesn't block the inflammatory process. They just promote the immune system's natural response so that you can heal better and faster. And so in order to discuss what we do and why we do what we do, we have to look at what inflammation is. Our sort of mindset or thinking in the sports community has always been around inflammation. What do we do for inflammation? How do we stop inflammation, block inflammation? And so let's dive into that a little bit and discuss what inflammation is, and then what the resolution process is. And so why do we have inflammation? Why is it beneficial? Well, inflammation is essential as a well-coordinated and natural process of protecting the organism in response to infection or tissue damage. And it's characterized by heat, redness, swelling, edema, pain, and an accumulation of immune cells, which is primarily neutrophils initially, and then followed by macrophages, pro-inflammatory macrophages, and then resolution macrophages. And so inflammation will serve to do several things. One is to eliminate the initial cause of the cell injury. Two is to remove the necrotic tissues and cells. And three is to begin the process of repair. So to put this in really simplistic terms, what we're trying to do is if we have a light bulb that's burned out, we've got to take the old light bulb out before we put a new one in. So inflammation is important because we take the old light bulb out. And so the inflammatory process will involve several steps and types of cells and chemical mediators, which are basically activated omega-6 fats. So you take omega-6 fats and you're going to activate them through specific enzymes. So you'll take them from the cell membrane. And again, omega-6 fats are going to be things that come from animal fats, peanuts, corn oil. Those would be examples of sources of them. And it's like a key that has no teeth. I have to use an enzyme to put the teeth into the key so it can turn a lock, and now it will have function. So these are activated chemical mediators, which are derived from these fats. And so I'll take phospholipase A2, I convert omega-6 fats into arachidonic acid. Arachidonic acid is then further converted into substances such as prostaglandins, thromboxanes, and leukotrienes. And if I look at this diagram or this slide here, you can see where some of the medications that we commonly will use will intervene. And there are times and situations where these are appropriate to use. But we have a tendency to overuse a lot of these things, particularly non-steroidal anti-inflammatories, which actually ends up being somewhat destructive for our athletes, thinking that we're helping them with healing and recovery or helping them to play, we sometimes will put them into a position where recovery is very difficult for them. So inflammation is supposed to be time limited. And initially, again, you get these arachidonic acid derived mediators like prostaglandins that are created. That's the initiation phase of inflammation. And then there's a second phase, which is an active separate phase called the resolution phase. And so in the resolution phase, there are specific mediators that were discovered, between 10 and 20 years ago. Dr. Sirhan up in Harvard found these things and then began studying these to figure out what they do. And these specialized pro-resolution mediators, or SPMs, again, they will allow the return to homeostasis, and they promote tissue repair and regeneration. And so under normal circumstances, when I'm working with a professional athlete, it's not uncommon to see an excessive tissue response to an injury, even a minor injury. And part of this is lifestyle driven. So somebody who's not sleeping because they're traveling, they're changing time zones, maybe their diet is not all that great, even though we try to work with them on improving their diet. There are emotional and physical stressors that are present. And it's difficult to keep them into a balance between sympathetic and parasympathetic drive. And this creates an issue for them in creating normal resolution phase, because those things have to be present. And so we get an excessive tissue response, and then it leads to a non-resolving or chronic inflammatory state. And this is what's actually tied with most chronic diseases. If you look at humans in general, osteoporosis, Alzheimer's disease, cardiovascular disease, these are all chronic inflammatory states. And so what we're looking for is a balanced response. So we have lifestyle that's an important piece to this, and nutrition and diet, but we oftentimes have to step in and give them help with the resolution phase because they can't get out of that inflammatory state themselves. And so this diagram here kind of shows a little bit more detail with this process. And you can see we're taking arachidonic acid, and this is going to be converted through enzymes such as COX. Off to the left, you get prostaglandin production. Again, you get pain, redness, swelling, neutrophil infiltration into an area, and edema, and that starts the process of getting rid of damaged tissue. I should have then a lipid mediator class switch. So I'm basically switching to the use of EPA and DHA, and I will use the same enzymes in a long stepwise fashion and produce what are called resolution mediators, these protectins, resolvins, and maressins, and the intermediate steps like HEPE, HDHA. And those intermediate steps have biological action as well. And so the goal is that I'm helping them with this process without shutting down the inflammatory state. I'm allowing that to happen. I'm taking the old light bulb out so that I can put the new light bulb in. And so these mediators then will cause the switching of pro-inflammatory macrophages into pro-resolution macrophages. This leads to tissue repair and regeneration. And this slide shows sort of the same thing from a different perspective. I have an injury, a tissue break or trauma, I get PGE2 as one of the mediators, pro-inflammatory mediators produced, neutrophil infiltration, then I get the class switch that happens. And you can see on the bottom here, I'm switching from innate immunity into adaptive immunity. Probably heard a lot about that with all of the stuff going on with COVID, that people have a difficult time with adaptive immunity and the imbalance that they sometimes have because they can't get into a resolution state. So this chronic inflammatory state can happen in that top line there if you don't have enough production of these resolution mediators like resolvins, lipoxins, maressins, and protectins. You can't get into this state of wound healing and homeostasis, which is supposed to be present. And so you get chronic degenerative change. This can happen in knees and tendons and muscles, ligaments. They all can be affected negatively by this. So our mindset should be really, instead of thinking about things from the standpoint of how do I block inflammation, how do I put somebody on an anti-inflammatory diet, or how do I get rid of inflammation, what we should be doing is saying, how do we keep inflammation from being excessive and out of control? And really the way that we do that is pushing for resolution. We need resolution and the production of resolution mediators for this to happen. We lose the ability to do this over time, and that's because we get stuck into a state where physiologically we are under recovered and not really in a position where we have enough production of these to get us into a resolution state. And so conventional anti-inflammatory thinking and treatment usually will inhibit these pro-resolution mediators, and unfortunately the process of blocking inflammation leads to significant side effects, and you're at higher risk for things like GI bleeds, even gut permeability, which is not ideal for an athlete in their training and response to training. The SPMs, and focusing on the resolution phase, will not result in the blocking of the inflammatory phase, but rather promoting a natural termination of that inflammatory process. So they'll resolve inflammation without compromising the immune response and without side effects, GI bleeds, again, kidney problems, degradation that happens with anti-inflammatory medication. So they'll promote rather tissue repair and regeneration by using SPMs. And this is a study that was done by Markwith in 2013, where these athletes were given as a treatment to look and see if ibuprofen would help with the recovery phase. They were given ibuprofen, and both pro-inflammatory and resolution mediators were measured 0 to 3 hours post-exercise and then 24 hours post-exercise. And what they found was that just a small dose of ibuprofen, they gave them 600 milligrams total, just that small dose had a significant problem with diminished SPM response during post-exercise recovery. And so you need two things. You need prostaglandin E2, PGE2, which we think of as a pro-inflammatory lipid mediator, which it is, but you need that for normal muscle protein synthesis and response to the beginning of healing. That's what initiates the process in part. But you also need these resolution mediators. And so the authors basically proposed at that point that SPMs played a role in a previously unappreciated role in immunological and adaptive muscle signaling responses during the early post-exercise recovery period. And their findings also suggested that the use of anti-inflammatory interventions to enhance post-exercise recovery would be at the cost of delayed or diminished natural resolution of the inflammatory response to exercise. So some of the questions that I get commonly from staff, from strength conditioning staff or from nutrition staff would be, why not just take EPA and DHA? And although I use them and I encourage people to eat fish, I encourage them to take omega-3s. The best way to think of this that kind of drives home the point is, why not just take flax oil? Why would everybody not just take flax oil and get alpha linoleic acid? Because our body has the enzymes to produce EPA and DHA, which is true, they do, but it's very slow. The process is very slow, it's inefficient. And if you measure in your athletes an omega index, or you look at omega-6s and 3s and somebody who does not eat fish or doesn't like to take fish oil, you'll see EPA and DHA are typically low. It's a slow process. Even if they get alpha linoleic acid, it'll be low. And you need omega-3s for cell membrane integrity and brain and eye health and lowering triglycerides. So it's still part of the equation. But SPMs, on the other hand, also it's also a slow multi-step process. And if somebody, again, is in a state where they're not sleeping well, or they have sympathetic overdrive and they're stressed, or they're under recovering and dealing with things like time zone changes and a diet that's not really well balanced between omega-3s and 6s, all of these would be reasons why somebody would have difficulty producing SPMs. And so it's very often that these people, even with giving them omega-3s, once I put them on SPMs, they feel the difference. And it's not just something that you give them and hope that, it causes a physiologic effect that they won't notice, something like taking maybe vitamin D as an example. But they take these SPMs and they notice the difference. They feel it. Their recovery is quicker. Oftentimes they sleep better. And so that's been my experience with using these things, and I'm a big proponent of them. And the second question that I get asked is, are they safe? Is it safe to use these? And again, they don't shut down your immune system. So they don't have the negative side effects that you see with anti-inflammatory medications. And they've been identified in just about every tissue in the entire body. And in fact, you'll see here, if you look, you'll see them in breast milk. You see them in brain tissue in very large amounts. So they're everywhere. And if you take a look at some of the studies that are available, looking at joints with, let's say, a patient with rheumatoid arthritis, what you'll find is even giving them EPA and DHA doesn't necessarily increase the production of SPMs. They're stuck in that inflammatory state. So giving them the SPMs themselves actually makes a difference for them. And the Liponova is the product that has been created by Solutex. And Solutex created these, they're characterized by phagocytosis enhancing bioactivity, which has been demonstrated through afferrocytosis assays. The Liponova fraction is bioactive, and it was designed to have a pro-resolution activity. And its safety and efficacy has been validated in various studies, both in vitro and in vivo. The ProResolve is unique because it is rich in this Liponova product with specialized pro-resolution mediators, and it supports the natural resolution of the inflammatory process, which is something that we need with sports injuries and stress. There is a project that is ongoing with human data, human studies ongoing. There are some human studies that are present, but this is one that is ongoing in professional athletes. This is called Product Gaudy, and the main objectives are to evaluate for the pain reduction with these athletes taking ProResolve. And they're looking at symptomatic knee arthritis. So these are football players, professional football players overseas, or soccer players for us in the US. And this is a multi-center study that is being done between Barcelona and Madrid through the Institute of Rheumatology. And the treatment program involves basically using 2 grams of ProResolve. Each gel capsule contains 500 milligrams of the Liponova. So they take 4 of those daily for 6 weeks, and then 2 capsules daily for the next 6 weeks, or they're given a placebo. And so there's 232 patients that are enrolled currently, and 116 patients in each group. And the variables will be looking at visual analog scale between 0 and 10, and looking at an arthritic or arthritis index, and also biomarkers of inflammation. So this should be coming out fairly soon too, which will give more information for those that are seeking human data on these. But again, looking at how these work and understand the physiologic process, it's been very eye-opening for me when I started to look into these, and my experience with them has been very positive, with great feedback from athletes. In fact, I would tell you that athletes that I do nutritional testing for and recommend in supplementation, the one thing that they consistently call back for, try to get the information of how do they get, would be the Sports ProResolve. It's very successful.